Welcome everyone to week 1 of your Leadership and Management or Complex Nursing Systems course. To start off our course together, I have a wonderful speaker to present to you this week. We have Dr. Maureen Greene. She is the president of the Wisconsin League for Nursing, and I had the privilege of hearing her give the presentation to our fall conference, fall conference. And I remembered it as I was developing this course in the weeks for it, and I said, I wonder if she would be so kind to come and share that message with all of the students. And she has graciously agreed. So I would like to introduce you to Dr. Maureen Greene.
Hello, everyone. This is such a wonderful opportunity that Dr. Curry has allowed me to participate in your asynchronous learning environment. And it's a wonderful experience to have the opportunity today to talk to you a little bit about my life. Unfortunately, in this type of a repertoire, I'm unable to get that engagement as to where you have been, but I hope my story today will have you thinking about where you might go. I have a lot of years in nursing. I know that you have taken the opportunity to continue your education, and I'd like to start with that type of a repertoire. I have 33 years of nursing practice. I started in a surgical unit many, many years ago, and I was very comfortable there. And it was a wonderful experience for me to go from my nursing assistant time to my nurse intern time period to the opportunity to work as a new professional in nursing service in care of the surgical patient. As luck would have it, they closed our unit and moved us to a different unit so that the orthopedic unit could have our larger rooms. At that time, we were the new wing. And that afforded me this opportunity called change. As a young professional, I wasn't used to that. I was in control of my education, in control of my destiny in terms of where I was going in terms of my nursing profession. And even the option of changing units started what is a snowball effect that I'd like to share with you today. So those early years of changing the unit and going to a new unit, we had the opportunity to build another group of nurses when we went to a larger unit, and we became a medical surgical unit. And so we had this influx of overflow from medical, which was a new domain for me. And it gives us the opportunity to look at what our service line can be and how you can learn. So I was being expanded as a young professional in my mid to late 20s. So you have this opportunity, and you're working through these things, and you have the opportunity in school to participate. And one of the things that was drawing me at that time is professional connections. So I talked to my colleagues in professional connections, and one of them was Sigma Theta Tau International, which is an honor society for nursing, and I was in a junior inducted honor society member. And at that time, I would go to the meetings locally, and I had the opportunity to chat with my friends and colleagues and professors that I had known at that time, and I told them that my career had changed, and our unit had closed, and I had moved to a new unit. And they, of course, sympathized a little bit with my complaining about this, but they also saw the vision and the possibility that that professional growth afforded me. And we had these conversations about, this is a stepping stone for you. You should learn as much as you can. So today we want to talk a little bit about professional growth. And I am the Wisconsin League for Nursing president. I took that opportunity when I was asked by a prior president of the Wisconsin League, associated actually with Concordia University. And when Dr. Call had asked me if I might entertain taking on the presidency through a president-elect role and then learning the ropes, I had the opportunity to say yes. So today's message to you is, when are you going to say yes for the next steps? And you have already said yes to your ongoing education. Education is our starting point, our field with which we get our knowledge. And when we get our knowledge and we practice, I want to mention to you that there's an action phase to that. It's an action phase not only where we take what we've learned and we implement it in terms of our practice, but it's an action step for change as to how we associate that with change that happens within our profession. So every time you participate or you raise your hand and you join a professional organization like I did with Sigma Theta Tau, like I have done with the Wisconsin League for Nursing, it opens up an opportunity for you to grow. And each of those times, whether it's through networking like I was doing with Sigma Theta Tau, or it's in conversation that you have with the Wisconsin League for Nursing, where you develop relationships and you develop a plan for correction and development for this organization. And that's what my mission has been in the last year that I've been in the presidency for the Wisconsin League. So I want to tell you, just in digression, just another little story about clinical practice. And I'm sure all of you who are working have potentially had similar or something that has revved up your mind and you've thought about it in terms of what's been going on in your practice. So for many years, I worked in the medical surgical area. And over that time, there was many years that the nurses would say to me on the unit, you know, Maureen, you are so bright, you should work in the critical care area. And I said, well, I really enjoy the medical surgical area, and in this example, I was very proficient at surgery. I had some specialty areas that I was very good at in the surgical area. I was starting to develop some of my knowledge of the medical area. I was not as strong in terms of cardiology. And so they kept encouraging me to go to the intensive care unit. Well, at one point, I completed my master's degree, and I had the opportunity to teach at the university level. And at the university level, they allowed you to take credits, and I decided to take some credits for edification and learning experience. And in that process, I was learning a nurse practitioner role. And one of the roles in terms of acute care was that you had to know some things about intensive care, which I didn't know a lot about. As I had mentioned, I was on med-surg for a number of years. So in that process of going through that, I decided that since I had a lax in understanding intensive care or critical care medicine, perhaps this was a timely phase for me to go on and transition to intensive care. I was given the opportunity to take a position in the intensive care unit, in this example, transferring from the PM shift to the day shift. Once again, a change in my life. And that afforded me the opportunity to get off of that PM shift where I'd been for 18 years and move up to the day shift. I want to tell you a story a little bit about the intensive care unit, because the intensive care unit, as you know, is very different than a standard med-surg unit, not only via technology, but the knowledge base with which we served. And this being a mixed intensive care unit, I was afforded the opportunity to take care of a diverse group of critically ill patients. And in so doing, I had a wonderful mentor, and we're going through a number of processes of learning not only the equipment, but also how to assess the patient, intervene, document, and we were in transition with the electronic health record even back then. So the point was, at one point, I was sitting outside my patient's room, having been instructed by my mentor on how to handle some of the complex issues that we were handling that day with the patient. And I happened to be sitting outside the room. We all had tables outside each patient room where you had some of your documentation and issues that you were managing. And I was thinking there, and at that time, the assistant head nurse, as we had called them at that time, was rounding, and she saw me sitting there, and she tapped me on the shoulder, and she said, "You have nothing to do?" And I thought, well, I said, I just finished up a set of vital signs, and I'm watching a change in the medication that we are running. I said, I'm actually thinking about my next step. Well, evidently, that wasn't the right answer. For her, if you weren't moving, you were not working. And I want to afford you the opportunity that unless we listen to ourselves and think, we are unable to do effective action. And so my message to that is sometimes in our environment, people don't really know where we're going or what we want, what we're doing, and they're thwarted by some of our ambition to do what's right. And sometimes it's in your silence and it's in your quiet that you establish actionable steps with good thought instead of just moving around or socializing or whatever else you could have done with your time. But this afforded me the time to collect my thoughts, to think about my next steps for this critically ill patient, where other people might perceive you as non-active. Now, I want to mention that for a reason, because my sitting down or taking that time period of rest was actually a time for me to reflect. And I think we need both. We need rest and we need reflection to maximize what's going on with our patient. But I also want us to take the time whenever we've had change steps is to sit back and to think how this change in this patient as I was describing will move forward, or what will that be for me in that next step. And so that little story about how people might not be able to perceive where you're going, if you feel comfortable with your reflection, you're moving in the right direction. So how do we establish that purpose in our life? We have a purpose for education. You all are sitting in class, you're listening, you're doing your homework, you're trying to be edified in terms of some of these advanced skills that we're teaching you. But the real issue is how do you establish purpose? So what I've established with my professional organizations is every time I've raised my hand now in saying I'll take the opportunity to serve, I have learned from that. So let me tell you about years ago when I finished my master's degree. So I brought a prop here today, and my prop is a golf club. And I just grabbed one from the garage today, so it's no specific golf club that's going to get you there. But it has purpose to discuss what we're going to talk about next. It's because when I was going through all that schooling back then, when I went back for my master's, when I took courses toward my acute care nurse practitioner, when I finished my PhD, whatever time period education gave me, it gave me the opportunity to think about what is my next step. And that next step, as I mentioned to you, started that first time as a young 20-something practitioner when they closed my nursing unit. That was the impetus for me to understand I could tolerate change, but even though change was happening to me, I had control of the outcome. To some extent, of course. I couldn't choose the unit. I couldn't choose how the unit was set up. Some of that stuff was already determined. But I could change myself. So, in so doing, I thought about myself as a professional individual with advanced degrees, and I started to think that I didn't have a very well-rounded perception of myself. I was going to school. I enjoyed school. School afforded me the opportunity to not only get out of the house, it afforded me the opportunity to expand my mind. But every time I went back to school, as you well know, you get frustrated. Those professors have high expectations. The schoolwork is challenging. And every time you have to sit down and write another paper to start that paragraph one, it's difficult. But what it really does allow you to think about is where am I going and what do I need to get there? So when I was in my master's program, I decided, I don't feel that I have enough well-rounded situation for just relaxing myself. I'm in school a lot. I'm doing well. I really need something that will afford me the opportunity to look outside the box. So what did I take up? I took up golf. And I started to do golf lessons. And the golf instructor that I had hired, actually paid for these lessons, was affording me the opportunity to learn how to swing this club. And one of the learning experiences I learned from those lessons is to keep your eye on the ball. And so he'd stress with me not only my posture, but how I address that ball and look at it keenly as it sits next to my club, and taking that full backswing, and then following through that ball as I looked at where I wanted that ball to go. And that is actually an analogy for our discussion today about professionalism. Because you can stay where you are at and do the same thing every day as we all do. But nursing is a lot more than the task that we ask you to understand. It is the conceptualization of why you're doing that task, the implications to your patient, your service line, and also to the society with which you're going to be discharging that patient to. And so really it is much broader, as my swing had to get broader in understanding my service as a master's prepared nurse. So this club is a reference to you in terms of life. It gives you a linear perspective that life goes forward. We don't go back. But the other issue is that you can see that ball, and really, the ball can go wherever your effectiveness in establishing that club, how that club face aligns with that ball, how effective you are at getting that backswing, all the way to a very competent foreswing, such that you get that ball to the designated area. So my golf club today is just a little bit of a prop to show you that your decisions that you make today, the times you raise your hand for participation, will afford you the opportunity for professional growth. So let's talk a little bit about joining professional organizations, doing something different when you have your opportunities. I said that I was nominated for the Sigma Theta Tau International as a junior. It's a wonderful opportunity. We talked about it as a class, and we were saying, well, what's that all about? And some of the referencing was very good on your resume. It's an international honor society. We should belong to professional organizations. And so I thought, well, great opportunity. So I signed up for it. Now, the difference between me and some of the colleagues that signed up for it and were fortunate enough to be inducted is the fact that I remained active in that organization for many, many years. And so many years, and I continue to be in that organization, but I do want to mention that I also took international and national office with Sigma Theta Tau, having elevated myself through the local chapter, to the regional chapter, to the national chapter, to participate more actively in my years of experience as a nurse. That was only afforded to me by the opportunity of raising my hand and taking the next step of learning. And I was heavily supported in that, not only in a professional vein, but also by my hospital system that saw value in terms of participating, and I was rewarded on that in terms of my raises and things like that. So I want to mention to you that when you participate actively, there can be a monetary gain, a professional gain, a personal gain, and also a learning gain that can occur. The Wisconsin League for Nursing is a national affiliated group with the National League for Nursing whose focus is nursing education, which of course is a foundation for any professional that understands that we need good nurse educators, great students, and the great opportunity to see nursing as a profession. And so the Wisconsin League presidency allowed me the opportunity to look at things differently as to what was going on in that organization and how I could serve. And so I had taken 2 years, actually, as the president-elect, to review what was going on, where it had been, and where the potential that it needed to go in this, computerized systems that we're using now, the way that we are more diverse, the state of Wisconsin being a large state, that we had members that were, all over the state, and how we could communicate. So the real mission is that you have to understand when you're in a professional organization, you are not alone. You don't run the organization yourself. Our organization is affiliated with a national group. We are constrained by the national group's expectations, and we need to maintain those. But also locally and regionally in the state of Wisconsin, we have to participate actively with other members that are participating with the Wisconsin League, and also your board and committee members. So you have to have vision enough to know that you are not alone, and it is not the expectation that you function independently as the president or the president-elect, but you actually are part of a team. And who better to learn on how to be a team is when you're in nursing service. All of us, when we are in work, we are with a group. And we all have to talk about not only our PCAs and our social workers and our physical therapists, where we need to get that patient. We all have to have a purpose, a goal, and a vision as to where that patient needs to go. It's the same with a professional organization. So effective communication between the board members, committee members, with a mission to serve, and to also outline and educate those individuals so they feel comfortable about what their role can be. And what I found in terms of being a professional in a professional organization is that not everybody is comfortable with that when they join professional organizations. And that's what I want you to know today. I encourage you to join professional organizations with an understanding that you are a valued member in that professional organization. If the timing and intent of being a part of that professional organization affords you the opportunity to give some time in a more focused way, please take the opportunity to volunteer for nomination for a committee. Perhaps it's a board position, perhaps it's a committee position, but remember, you should always take a committee or board position that fits you. Don't just take something that's open, or they say, you know, we have a secretary position open and you don't like to take notes or take minutes or whatever, then this is not the job for you. So it's very important that you align yourself professionally with an organization, with a task, with a group that you've been asked to be nominated that fits you. So that should be your first question to yourself when asked. It's all right to also say, can I think about that for a little while and get back to you? That affords you the opportunity to reflect if this is a good time in your life, if it's a good time in terms of what's going on with you, and also if it's a good fit for you. Secondly, it should be an expectation that you are transitioned into that role with some level of instruction. That tends to be the most problematic area that I've seen in any professional group that I belong to, is transitions can be difficult. Just like it was when my unit closed and we had to go to a new unit, I was uncomfortable. It even becomes more uncomfortable when you don't have the tools available for you to do an effective job. Remaking things from the base forward is very difficult because you don't have any reference to where you're going to go or what you need. And so that can be very difficult. So I would encourage past board members to mentor, other committee members who were active in the prior years to mentor through, and hopefully you'll get some documentation that can guide you in terms of some of the steps. Having said that you have a repertoire that you can work with, the other reason that we want individuals to raise their hand and take the opportunity to serve professionally is we're looking for creativity. We are looking for your vision. We are looking for you to say, it's about time that I learned something new, whether it's golf, a committee work, actively working at your hospital in shared governance, whatever it is to say, this is my opportunity to have a voice and to have an action. And in doing an action, it's very important that you ask questions, that you are respectful to the group, that you talk about possibilities, and also offer the ability to listen in case maybe your suggestion isn't widely accepted. You may be able to maneuver that in at a later time period. So you have to be strategic, is what I'm saying. The ability to be strategic. And you should be building that repertoire as you work as a nurse, as you work within your teams as a professional, and now as you work within professional organizations. Professional organizations are always looking for what I consider the best and the brightest, because that's the reason you raise your hand. We really don't want somebody that doesn't attend the meetings, that doesn't really have anything to offer, that is possibly a problematic type of person that's argumentative. That can be somewhat a difficulty, of course. So what I'm saying is that we want you as professional nurses to grow yourself as professionals. And that's why Dr. Crary has incorporated this into your lecture, because it's not just the work we do, it's the profession that we are showing every time we go out there. As a nurse, as a professional, when your vice president of nursing asks you a question, they want your information. And that's what we're seeing in shared governance at the hospital settings that we work at. We want to hear from you, the caregiver. I want to hear from my committee members, my board members, as to who can make this better. It's not only my job, it's the whole of the job. And if we can delegate those tasks effectively, we will get the job done systematically. So we talked about being strategic, we talked about being systematic, we talked about raising your hand in nomination, considering where you would fit with that organization, the best fit possible for the success of that. Now there was one time, a number of years ago, that I was actually in my PhD program. And was it my PhD program? Yes, actually I think it was. Beginning of my PhD program. And one of the things that I didn't have the opportunity to do when I was in my master's program is to do any extracurricular activity with my professors. The professors in the master's program often allowed you to do research assisting, teaching assisting, and things like that, where you could actually learn on the job, so to speak, how to be an effective professor, how to be effective research assistant, do data, things like that. And I was unable to do it at that time. I was very busy with 3 small children, plus going to work, plus going to school. So I reflected upon it, and that wasn't a good opportunity. It was different when I went back for my PhD. But in affording myself the opportunity to do the PhD, I was also in a different state of professionalism by that time. But one of the things that I hadn't had the opportunity to do is to really do some deep dive program development. Sigma Theta Tau, as I had mentioned, the Honor Society, had a mentorship program called the Chiron mentoring program. And they were asking for volunteers to self-nominate to be tagged up with a high-level professional in the United States to do some program development that you would be able to guide yourself. It was at that time I had talked to my professor who was doing some work about nomenclature for nursing diagnosis, care planning, longitudinal care planning in patients, and some defining terms of how we move our patients forward in making decisions about care planning. And I asked if she might want to participate with this Chiron program with me. This was an opportunity for me to raise my hand and ask for mentoring. That was a learning experience for me on the outside. It's a 1-year commitment. We went to Indianapolis, Indiana for our first introductory course, so to speak. It was a weekend course on how to do this work. I was guided by not only Sigma Theta Tau representatives, but also by my sponsor in this example, my professor from the university. And she guided me through a program of which I worked with some individuals from Sigma Theta Tau on this nomenclature and the like for a year. But it was also gauged in terms of my ability to participate in terms of time and talent. Of what I learned from that is that these individuals valued mentoring and walked me through a process. And what I want you to know is that nursing has mentors for you. So when you are in professional organizations, they afford you the opportunity to ask questions, to be mentored, to walk in shoes until you feel comfortable, to get your swing down because you're not going to be good in the beginning, but it gives you the opportunity to at least try. And that is what's wonderful about the multidimensional aspect of professional involvement. It gives you a whole new breadth of participation outside not only work, but it gives you a new dimension on how to handle your personal life too. And so I want to mention to you how valuable it is to raise your hand, to participate in professional organizations. To be a member is very important. To be an active member is a calling which I hope all of you listen to, because sometimes it's that calling that says, it's calling you to do something different, like that golf that I was mentioning before. It gives you something to hold on to. It gives you the vision of the landscape, like I loved in golf, the ability to go out in a cart and see all the animals that are out there and the beautiful trees and breathe deeply. Because as you grow, that breathing deeply allows you to grow inside, mentally, and with colleagues that are there available to you to mentor you through these processes of change. So today's lecture, which has been a wonderful experience for me today, is to talk to you about change. We started this lecture about when things don't go as you thought they would go in the beginning of your career, or your ability to make a choice about going back for your education. When you suddenly feel that unsettled feeling in your psyche that says, I think I need something different. Professional involvement through belonging to professional organizations will afford you those opportunities too. Be selective in what you join. It should be in congruence with what your mission is. It changes over time, but it also is a commitment not only time-wise, but financially. I belong to at least 10 professional organizations, which can be considered excessive. But in terms of being excessive, I support them financially because of the mission with which they serve. In the state of Wisconsin, which is my home state, I have the opportunity to participate on advisory boards because of my commitment with those agencies. And that makes me the opportunity to share my knowledge and skills with others around the region. So be selective and start slow. If your university affords you the opportunity to join a professional organization like Sigma Theta Tau, like Wisconsin League for Nursing for Educators as an example, the opportunity to participate with clinical nurse specialty if that's your area, whatever it is, think hard about why you want to join, how much commitment you can do, if this is a service line that is valuable to you. So today's lecture has been about self-reflection, change, and the possibility for growth. And I hope that you've learned from this that sometimes just taking a long stick, standing tall, and knowing what your purpose is and keeping your eye on that ball as to where you've been and where you want to go is really the fortitude you need to be the professional nurse you've always wanted to be. Thank you very much for this opportunity. And if you've ever liked to talk, please contact Dr. Crary, and it'll be my pleasure to share anything else with you and to even talk about where you'd like to go in the world, as I've had the opportunity to learn from others. Have a great day.
Thank you so much. I hope everyone was as inspired. I've heard it twice, and I was as enthralled the second time. And thank you again.
Have a great day.